Now that rules for wearing masks have been relaxed, a lot of people are confused about best practices to keep themselves and their families safe from the virus, especially if they have young kids. 13 on your side, Sarah Makuta verifies if it's okay for vaccinated adults to ditch the mask when they're out in public and still feel comfortable at home around unvaccinated children.
Now that the CDC has changed mask guidelines, many people are confused about the best way to protect their family, especially families with young children that are not currently eligible to get a COVID vaccine. 13 on your side viewer Rick Shellis in Muskegon asks us to verify, should vaccinated parents of young unvaccinated children go without masks in public if they're returning home to their kids? Our sources are Dr. Nirali Bora, medical director at the Kent County Health Department, and Dr. Rosemary Olivero, a pediatric infectious disease physician at Helen DeVos Children's Hospital.
So what we understand with the vaccine is that it is really effective at preventing COVID in those who've been vaccinated. Those who do tend to get COVID after being vaccinated, it's quite rare. They tend to have a mild illness, and they're much less likely to pass it on to others.
In general, it would be safe that if you're a fully vaccinated person, so you've had your full vaccine series plus 2 weeks, that generally would be a safe thing to do.
So we can verify that yes, vaccinated parents of unvaccinated kids can feel confident to be in public without masks and return home. However, experts say that only you can decide on the safest practice to protect your family.
So at this point, we do feel comfortable that parents who are vaccinated can go unmasked as long as their children at home don't have underlying health conditions.
Data that we've seen so far in those people across the world who have been vaccinated, that if they get exposed to the virus that causes COVID-19, generally they do not harbor the virus. And if they do harbor the virus, it's at such a very low amount of virus in your nose or throat that it's not easily transmittable to another person.
The experts recommend that children ages 2 to 11 should continue to wear masks in public and at indoor gatherings with people outside of the household. With your Verify, I'm Sarah Makuta.